Thank you for volunteering at this Vmed Wellness Initiative screening. We are really lucky to have people like you around to help us out with them. Measuring blood pressure is one of the most important things that we do at these screenings. And while we realize that it's not the ideal place to check blood pressure, we can still try to improve outcomes by being as technically proficient as we can be. As it turns out, studies show that doctors and nurses are not very good at all at checking blood pressures. Only about 2 to 3% of them do this perfectly, or even close to perfectly. So to measure a good blood pressure, you have to do a few things. First, you have to understand the equipment. And this is a sphygmomanometer cuff. And this is the part of the cuff that I want to draw your attention to. It's called the bladder. This is the part that actually inflates when you put the air in with the bulb. And this needs to be at least going around half the way around the arm. If it doesn't, that means it is too small. And if it is too small, you're going to overestimate the person's blood pressure. Now, if it is too large, that usually doesn't have a huge impact on the blood pressure measured. So the other things that you want to check are whether the patient is relaxed. Because if they're not, obviously they're going to have a slightly overestimation over there. So when they walk in, you want to make them sit down and relax a little bit before you start measuring it. So you ask them the questions before you measure it, not during. Other things to think about: have they just had some coffee? Have they just been running? Anything like that. And always ask about any sort of medicines that they're on that may affect blood pressures. And now we will demonstrate how to measure the blood pressure to the best of our ability. Alright, so the positioning is one of the most important things when you're measuring blood pressure. If you notice how I position Chad here, his feet aren't crossed. He's sitting relaxed in a chair with a back. If there's no back to the chair, then your diastolic blood pressure reading is going to be higher than it really is. As you can see, his arm is at the level of his heart, roughly, and it is supported. He's not holding it up because that would absolutely increase your blood pressure. In addition, when I measure his blood pressure, I will not be talking to him. I'll just ask him to take it easy, relax a little bit, think calming thoughts, and then we'll start placing the blood pressure cuff on him. As you place the blood pressure cuff, you've got to line up this line that says artery index marker with the patient's brachial artery. At that point, then, as you can see, Chad's arm is nicely placed for this, nicely sized for this cuff. One of the usual complaints that people have when their blood pressure is being checked is that it hurts too much, the pressure is too much. And to get around that, what you should probably do first is assess what the systolic blood pressure of the person is by palpation. For that, what you're going to do is you're going to inflate the blood pressure cuff. Now you'll inflate the cuff, and at the same time you're checking the radial pulse, and you're watching the monitor to see where the radial pulse disappears. In Chad's case, I see the radial pulse disappearing at 100 millimeters systolic. So that gives me a fair idea that, so in his case, I don't have to inflate up to 240. I can just inflate till 120, and that's fine, and then I can sort of slowly come down and assess his systolic pressure. This is the point where you have to take out your stethoscope and use the bell. Don't use the diaphragm, use the bell, because the carrot cough sounds that you're listening for are actually fairly low frequency noises that are better picked up with your bell. So, let's see. So, when you never place the stethoscope head underneath the cuff, that basically makes the skin stretch out and serve as a diaphragm instead of a bell. And then you will inflate the PP cuff. You inflate the blood pressure cuff to the systolic pressure that was suggested by your earlier palpation. In Chad's case, it was about 100. So I will lower it slowly. And as you see, I lower it at a pace of about 2 millimeters per second. This prevents me from underestimating the systolic pressure and overestimating the diastolic pressure. And in Chad's case, I heard the carrot cough sounds come on at 100, and I heard them disappear at 60, which gives him a blood pressure of 100 by 60. The blood pressure is actually a very important vital sign. It helps physicians figure out which drugs the patient needs to be on, if any. And therefore, consistently measuring the precise blood pressure of your patients is very important for their health and safety. If you follow the techniques that we've shown in this video, you will record blood pressure more reliably and more precisely, and that will ultimately make you a better physician. Again, thank you so much for volunteering to our screenings, and we look forward to seeing you tomorrow.